Hi, everyone. So, the case that I chose for this discussion is the Baby K case. So, Baby K was born in October of 1992 in Virginia with anencephaly. This means that Baby K was born with an underdeveloped brain and an incomplete skull. This or anencephaly is caused by a defect in the formation of a baby's neurotube during development. So these babies can be born stillborn, or they can actually, but they only live for a couple hours after birth. And how long they survive depends on the severity of the anencephaly. So the baby K's mom is Mrs. H. Mrs. H insisted on doing everything possible for baby K. So she wanted to do everything that could possibly be done to keep baby K alive. Unfortunately, these extraordinary measures included CPR and ventilator support. These extraordinary measures are called extraordinary measures because infants with that are or babies that are born with anencephaly are not compatible with life. It is not common for them to get CPR or any type of ventilator support. Any care that is done for babies with anencephaly, if they're still alive, is just focusing on keeping the baby as comfortable as possible. Um, Definitely not these extraordinary measures because it is known that they will not survive past the couple days or hours that they usually do survive. Um, of course, this includes not having ventilator support. So while these extraordinary measures are not common for these anencephalic babies, Baby K's mom was insistent on doing everything that was possible, even after the healthcare providers told her, your baby's not going to survive. We should not be doing this. We do not recommend it. They recommended taking Baby K off of all of these, off the ventilators, and just letting Baby K pass naturally, like babies with anencephaly usually do. But Mrs. H did not want to listen to any of the recommendations, and she actually fought legally and won an appeal. And because of this, Baby K was admitted to a nursing home, if I remember correctly, and Baby K was admitted to the hospital multiple times from the nursing home during, I think it's 2 years of life that Baby K survived, 2.5 years, for several reasons. One of them being that individuals or these babies born with anencephaly are missing parts of their brain. Most of the time, it's parts that are vital for controlling functions that keep us alive, such as breathing. So a lot of the times that Baby K was admitted was because of respiratory issues, and eventually Baby K did eventually pass away from respiratory failure. Another important part of this case is Mrs. H, Baby K's mom. So she was part of or represented, I think it was the sanctity of life principle, where she believed that any life deserves to be saved, or everything should be done in order to try to keep someone alive, including extraordinary measures. So this explains why Mrs. H wanted all of these extraordinary measures to be done for her child, even though they were not recommended. Um, So that's the gist of the case. So I thought some of the ethical issues that were important to this were autonomy, even though Baby K was obviously a baby. We should put ourselves in the shoes or in that position where, let's say, maybe we end up in a car accident. We are still able to basically decide beforehand if we want to survive or not, and just putting yourself in that position and trying to think about how you would feel if you were in pain and if you were kept alive but then you had to go back. Maybe you had to get CPR again, but then you come back, and then just kind of that in and out situation where your time is going to come soon, but you keep doing all of these extraordinary measures to keep yourself or someone else alive, and just all the pain that you go through going through that, knowing you're not going to have a normal life. And I think autonomy is a really big part of this. Even if they're an infant, a baby, I feel like Mrs. H should have been able to recognize that this is a condition where it is not compatible with life. We know it's not compatible with life. They told her that. But she still had the hope. I get it. She's a mom. She had the hope her child was going to stay alive. But I think there has to be a point where you realize you have to do the best for that child, even if they obviously can't make the decision for themselves. You have to be the bigger person and make the decision for them. So I think autonomy was a really big thing in this one. And then another one that I thought about, or that I really found that came into it was the non-maleficence, um, where yes, maybe we are trying to do good for this infant, but is it really doing good if we know that the child is not going to survive past a certain amount of hours or days? So I think that's something else that has to be taken into account too. Just yes, maybe we might be doing something good for them right now. Maybe they're gonna live another day. Is it worth the risk if we know they're not gonna live long term? If it's just a couple days, yes, maybe the parents get to have a couple more days with them, but is it really worth the risk? Especially when you're using all of these resources for someone that could be used for someone else. Um, and then thinking about the implications of the case, and to how it compares with current healthcare policies or practices. I work at Children's Hospital, so I have seen a lot of cases like this where parents try to do everything they possibly can to keep their child alive. I work in the ICU, so I have definitely seen a lot of cases like this. Um, I wasn't there for this, but there was a patient who had cancer. She was older. She was about in her teenage years. She had cancer for a long time, and she loved her parents, but she was kind of tired of feeling sick all the time, of being in the hospital, getting all the meds. And so she told this to one of the nurses, and she told them that she was afraid to tell her parents that she did not want to continue with treatment, um, for the sake of not wanting to hurt her parents. Eventually, there was a conversation with the parents. The child told the parents what she wanted. Eventually, obviously, the parents took that really hard. Obviously, no one wants to lose their child, but they did allow her to not be on those meds anymore. She did get taken off of her meds. She did eventually pass away. But so for this, I feel like that this is where the autonomy comes in, and this is where Mrs. H did maybe considered what the child was going through, where they're in pain, they're suffering. It's a condition where they know they're not going to survive, or with the cancer, maybe they will, but they have to go through all these treatments and medications. So I think that really brings in just ethics in general and the autonomy, where if a child says something, even if they're just a child, you should really take that into consideration. There was also another situation where a baby, the baby had drowned, and the baby was basically brain dead, or not basically, was brain dead, but the parents kept them on, the life support on the ventilator for the sole reason of them not wanting to let their baby go, and basically having that hope that they're gonna come back. But the doctors told them that's not gonna happen. And I remember all the nurses. So this was actually recently while I was working there, and I remember the nurses just saying how sad they felt taking care of this child. They knew that the child was dead. So I just feel like taking that into consideration, as being a nurse, and obviously being a future nurse, I want to work with kids. So this is something that really hits home with me. I want to work in the ICU, and I'm going to see all these difficult situations. So I just feel like things like this are something that we have to consider, putting ourselves in the child's shoes and the parent's shoes, and trying to find that good medium and how to talk to them and let them know, like, hey, like, your child, I'm sorry, but your child is probably or will not survive this, and trying to find that common ground in the right words and like how to have that conversation with them. So then I found another case that was similar to this, where in Texas there's a case with a 10-month-old boy who drowned, and the doctors told them there was no brain activity, but the parents were fighting to keep them on life support, and they did go to stuff. So it's very similar to baby K. It's very similar to the cases that I've seen here. So I guess this really just brings about the questions of, at what point do we as future nurses, like, if we can even intervene, what do we say? Like, how would we go about that situation? Like, how do we even tell a parent that, hey, it's maybe time to let your child go? We have done everything there is to do. Like, I know as nurses, it's not our job to tell them that. That would be the healthcare provider's job. But as nurses, we're there to support them. So I feel like that's probably one of my bigger questions, and I'll add that into my when I post the video. So think about that and let me know what you think.